What is capsular contracture in silicone breast implants? Have you ever wondered what happens when a silicone breast implant does not behave as expected? Capsular contracture is a common complication that can occur after breast augmentation. It involves the formation of a thickened scar tissue capsule around the implant. This capsule forms as a natural response to the implant, but in capsular contracture, it becomes excessively tight and fibrous. This tightening can lead to the implant being squeezed, resulting in a hardening of the breast, a change in shape, and sometimes even discomfort. The process starts when the body creates a fibrous capsule made of collagen around the silicone implant. This is meant to isolate the implant from the surrounding tissue. However, in capsular contracture, this capsule tightens more than it should. The result can be firmness and visible changes in the breast's appearance. Medical professionals often use the Baker scale to classify the severity of capsular contracture. Grade I represents a soft, natural breast, while grade Roman IV indicates a hard, painful breast that may require surgical intervention. Several factors can increase the risk of developing capsular contracture with silicone implants. Studies have shown that silicone implants are associated with a higher incidence of capsular contracture compared to saline implants, with some research suggesting that the risk can be more than double. Additionally, smooth-surfaced implants are more likely to lead to this complication than textured ones. The placement of the implant also plays a role. Implants placed above the chest muscle tend to have a higher risk than those placed beneath it. Other risk factors include infections, blood accumulation, fluid accumulation, radiation therapy, and possibly a genetic tendency to form excessive scar tissue. When it comes to managing capsular contracture, surgical options are often necessary. This can involve removing the capsule through a procedure called capsulectomy or releasing it via capsulotomy. Sometimes, this is done alongside replacing the implant. However, it is important to note that recurrence rates after such surgeries can be significant. Non-surgical treatments are limited and mostly experimental, as there are currently no FDA-approved medications or devices specifically designed to prevent or treat capsular contracture. Some emerging methods, such as using leukotriene receptor antagonists or acellular dermal matrices, are being researched but requiring more validation. In conclusion, capsular contracture in silicone breast implants is a condition that results from an excessive fibrotic reaction, leading to hardening and distortion of the breast. Understanding the risk factors associated with different implant types and surgical techniques can help minimize the chances of this complication. If you are considering breast augmentation or are experiencing issues with implants, it is essential to consult with a qualified healthcare professional for personalized advice and treatment options.